Welcome to another episode from the Veterinary Research Channel. Today, we delve into a fascinating and rather uncommon case of a foodborne illness affecting one of our feline companions. The subject of our discussion comes from a detailed case report titled Clinical and Genomic Features of Listeria monocytogenes-associated mesenteric lymphadenitis in a cat. This research, conducted by Miguel Garcia de la Virgen and colleagues from various institutions in Spain and France, sheds light on a rare presentation of a well-known bacterial pathogen in cats. Listeria monocytogenes is recognized as a significant foodborne pathogen impacting both animals and humans, causing a condition known as listeriosis. This bacterium, classified as a gram-positive, facultative anaerobe and facultative intracellular organism, has the ability to invade the body and cause serious disease in over 40 animal species. In both humans and animals, Listeria monocytogenes can breach critical barriers within the body, including the intestinal lining, the placenta during pregnancy, and even the blood-brain barrier. This can lead to a range of severe health issues such as gastroenteritis, infections affecting the mother and fetus, and inflammation of the brain and its surrounding membranes, known as meningoencephalitis. Tragically, the overall fatality rate associated with listeriosis in humans is estimated to be quite high, ranging from 20 to 30%. Beyond these widespread infections, Listeria can also establish localized infections in various organs, including the skin, joints, heart, and, importantly for our discussion today, the lymph nodes. In human medicine, it's observed that listeriosis predominantly affects individuals with weakened immune systems and pregnant women. Interestingly, while Listeria monocytogenes is a recognized threat across many species, cases of listeriosis in cats and even large captive felines are reported infrequently. When it does occur in felines, it can manifest as a systemic infection affecting the entire body, involve the central nervous system, or present in more localized forms, such as inflammation of the mesenteric lymph nodes. The relative scarcity of clinical cases in cats has been supported by laboratory studies suggesting that felines might possess a certain level of resistance to experimental infection with Listeria monocytogenes. While inflammation of the mesenteric lymph nodes associated with Listeria monocytogenes has been documented in both cats and cattle, there has been a notable lack of detailed information regarding the genetic diversity of the bacteria within the affected lymph node, the specific virulence factors at play, or any traits related to antibiotic or disinfectant resistance in the strains involved. Therefore, the objectives of the study we are discussing today were multifaceted. The researchers aimed to thoroughly describe the clinical presentation of the illness in a cat, document the findings from diagnostic imaging, and detail the cat's response to the treatment administered. Furthermore, they sought to determine if multiple genetic types of Listeria monocytogenes could coexist within the lesion in the affected lymph node, and to comprehensively characterize the genetic makeup of the Listeria monocytogenes strains that were implicated in the infection. Now, let's move on to the results of this intriguing case study. The subject was a 4-year-old female cat who had been spayed. This cat had been experiencing a lack of appetite and weight loss for a full year prior to being examined at a veterinary referral practice specializing in oncology. The cat's diet consisted of commercial dry cat food, and while it did not have direct outdoor access, it lived in a household with other cats. In the 2 weeks leading up to the veterinary consultation, the cat had also begun to experience sporadic episodes of vomiting and diarrhea. Notably, the owners had not observed any fever or neurological abnormalities. Initial laboratory tests, including a complete blood count and serum biochemistry analysis, revealed some abnormalities. The cat showed a mild increase in white blood cells, specifically neutrophils, suggesting an inflammatory response. The red blood cell count was also elevated, and the total protein level in the blood was lower than normal. A slight decrease in platelet count and a mild elevation in blood glucose and creatinine levels were also noted. Importantly, tests for feline immunodeficiency virus and feline leukemia virus, both of which can suppress the immune system, came back negative. To further investigate the cat's condition, abdominal ultrasound and computed tomography scans were performed. These imaging techniques revealed a mass in the right middle abdomen, specifically in the region of the ileal lymph nodes. The mass was described as rounded, measuring approximately 4.5 by 4 centimeters. It had well-defined but slightly irregular borders and appeared as soft tissue on the scans, containing multiple small, mineralized areas. Based on these findings, an exploratory surgical procedure was undertaken, which confirmed the presence of a significantly enlarged lymph node near the ileum, measuring over 4 centimeters in diameter. This affected lymph node was red and firmly adhered to the omentum, a fatty tissue in the abdomen, while the other mesenteric lymph nodes appeared normal. An incisional biopsy, partial surgical removal, and omentalization, a surgical technique to promote drainage and healing, were performed on the affected lymph node, which was found to contain purulent material. Microscopic examination of the tissue sample revealed necrotizing and pyogranulomatous lymphadenitis, indicating significant inflammation and tissue death with the presence of gram-positive bacteria within the lesions. When samples from the lymph node were cultured on various growth media, there was a profuse growth of Listeria species. Further specialized testing confirmed the identity of the bacteria as Listeria monocytogenes. Specific staining techniques ruled out the presence of fungi or mycobacteria, and there was no evidence of cancer in the examined tissue. Following the surgery, the cat received supportive care along with a broad-spectrum antibiotic treatment. This included intravenous administration of Amoxicillin clavulinate and Marbofloxacin, as well as an analgesic for pain relief. The cat showed good recovery from the procedure and was discharged from the hospital after 2 days with oral Amoxicillin clavulinate to be continued at home for the next 12 weeks. Regular follow-up examinations, including abdominal ultrasound, showed a positive response to the treatment. After 4 weeks, the cat was no longer showing any clinical signs. By 16 weeks, the size of the affected lymph node had significantly decreased. A final clinical examination 12 months after the surgery revealed no return of clinical signs, and ultrasound examination showed the ileal lymph nodes had returned to a normal size and appearance. Interestingly, when the Listeria monocytogenes bacteria were cultured from the affected lymph node, 2 distinct types of colonies were observed, one blue and one white. Further genetic analysis, including whole genome sequencing, revealed that these 2 isolates belong to the same clonal complex, known as CC121 and serogroup IIA. However, they exhibited some genetic differences, with 20 variations in their core genome multilocus sequence typing and 26 single nucleotide polymorphisms across their entire genomes, indicating a close evolutionary relationship. One notable difference between the 2 isolates was a single amino acid substitution in a protein called PRFA. This subtle genetic change is thought to potentially affect the activity of PRFA, which in turn regulates the expression of key virulence factors such as phosphatidylinositol-specific phospholipase C and Listeriolysine O. This difference in gene expression likely explained the different appearances of the colonies on the initial growth media. Consistent with other Listeria monocytogenes strains belonging to this particular clonal complex, both isolates possessed a pathogenicity island, known as LIPI1, and a premature stop codon in the INLA gene, leading to a truncated form of the internalin INLA protein. Notably, they lacked other pathogenicity islands, LIPI3 and LIPI4. Genes associated with intrinsic resistance to certain antibiotics, and the stress survival island SSI2, which provides tolerance to alkaline and oxidative stress, were present in both isolates. Additionally, they carried a transposon, TN6188, harboring a gene that confers tolerance to benzalkonium chloride, a common disinfectant. Finally, let's delve into the discussion of these findings and their implications. The researchers highlight that in humans, inflammation of the lymph nodes caused by Listeria monocytogenes is an uncommon occurrence, but carries a significant mortality rate, comparable to more widespread invasive listeriosis. Human cases have been reported in various lymph node locations and often affect older individuals with underlying health conditions that compromise their immune systems, as well as those with concurrent cancers. In the veterinary world, fatal cases of mesenteric lymphadenitis due to Listeria monocytogenes have been reported in cattle, and a severe form of lymph node inflammation with bloodstream infection has been seen in a reindeer calf. More recently, Listeria monocytogenes-associated mesenteric lymphadenitis has been documented in 3 other cats. Including the case presented in this study, it appears that this specific manifestation of listeriosis is rare in cats in Western countries, with only 4 reported cases in total and, encouragingly, no reported deaths in these feline cases. The current case demonstrates that a combination of surgical intervention to reduce the size of the affected lymph node, along with omentalization and appropriate antibiotic treatment, can lead to a complete resolution of Listeria monocytogenes-associated mesenteric lymphadenitis in cats. The study authors note that there is no established guideline for the duration of antibiotic treatment for bacterial lymphadenitis in the abdomen. Currently, the length of treatment is determined by the individual veterinarian based on their clinical judgment and the patient's response. One previous recommendation suggests continuing antibiotics until the enlarged lymph node is no longer detectable by imaging. However, even following this criterion, there remains a possibility of the infection recurring. In the case described, the initial antibiotic choice included amoxicillin clavulinate, which covers a broad range of bacteria. While Listeria monocytogenes itself does not produce beta-lactamase, an enzyme that can inactivate amoxicillin, the combined antibiotic was continued due to the positive clinical response observed, consistent with previous feline cases. A switch to amoxicillin alone might have been considered, but the successful outcome justified the continued use of the initial regimen. The researchers also discussed potential risk factors that might predispose cats to developing clinical listeriosis. These include the consumption of food contaminated with Listeria and underlying conditions that weaken the immune system. Previous studies have found Listeria monocytogenes in a significant percentage of frozen raw pet food products marketed in the Netherlands and the United States. Interestingly, another Listeria species, Listeria grayi, has even been found in dry cat food, indicating that while less common, dry food could also serve as a source of Listeria infection. The cat in the current case was fed a commercial dry cat food and did not have outdoor access. Regarding immunosuppression, studies have shown that cats chronically infected with feline immunodeficiency virus are more susceptible to developing clinical listeriosis following experimental infection. Furthermore, inflammation of the brain and spinal cord caused by Listeria monocytogenes was diagnosed in a cat infected with feline leukemia virus, suggesting that this other immunosuppressive virus could also facilitate bacterial invasion of the central nervous system. Similarly, in humans, Listeria lymphadenitis has been linked to predisposing factors such as older age, cancer, and diabetes. However, in the 4 reported cases of Listeria monocytogenes-associated mesenteric lymphadenitis in cats, including the present one, no such predisposing factors have been identified. Given the limited number and design of existing studies in cats, further research will be necessary to determine if there is a true association between Listeria mesenteric lymphadenitis and these types of underlying health conditions. The genetic diversity observed within Listeria monocytogenes is known to reflect differences in the potential for causing disease among different strains. Certain clonal complexes, such as CC1, have been more strongly associated with infections of the central nervous system, while others, like CC121 and CC9, are more frequently linked to food sources. The current study, along with previous findings, demonstrates that even Listeria monocytogenes isolates belonging to clonal complexes generally considered less virulent can still cause disease in cats, a phenomenon also observed in human cases of Listeria lymphadenitis. The researchers propose that the infection in this cat likely originated from the intestine, with the bacteria possibly entering through Peyer's patches, which are lymphoid tissues in the small intestine, rather than directly through the intestinal lining. This hypothesis is supported by the finding of a truncated inla protein in the bacterial isolates, which might affect their ability to invade the intestinal epithelium. The lack of widespread signs of bloodstream infection and the involvement of only a single mesenteric lymph node also suggest a more localized initial infection. However, the possibility of the lymphadenitis developing as a result of a transient bloodstream infection cannot be entirely ruled out. Studies examining the presence of Listeria monocytogenes in the feces of cats indicate a low prevalence of intestinal carriage in this species. The authors emphasize that mesenteric lymphadenitis should be considered as a possible diagnosis in cats presenting with gastrointestinal signs when an abdominal mass is detected. They also raise an important point about the zoonotic potential of this condition, noting that it is currently unknown whether affected cats might shed the bacterium in their feces, potentially introducing it back into the environment and posing a risk to public health. This detailed case report provides valuable insights into a rare manifestation of Listeria monocytogenes infection in cats. The combination of clinical observation, advanced imaging, and detailed genomic analysis has allowed for a comprehensive understanding of this particular case and contributes to our broader knowledge of listeriosis in companion animals. The study also underscores the importance of considering foodborne pathogens in the differential diagnosis of gastrointestinal disease in cats and highlights the need for further research into the potential risk factors and transmission dynamics of Listeria infections in this species. Thank you for listening to the Veterinary Research Channel. A link for the referenced paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.